So given all that, what do treatments look like? Where do doctors usually start?
Often the first line of defense is antiperspirants. Not just the regular kind, but often prescription strength ones.
Have those work differently?
They typically contain higher concentrations of aluminum compounds that physically plug the sweat ducts, reducing the amount of sweat that reaches the skin surface.
Okay, and if those aren't enough?
Then healthcare providers might look at other things. There are certain medications, sometimes topical, sometimes oral, that can help reduce sweating systemically or locally. There are also therapies like iontophoresis.
Iontophoresis, what's that?
It's a procedure usually for hands and feet where you immerse them in water and a mild electrical current is passed through it. It's thought to temporarily block the sweat glands. Needs regular sessions, though.
Interesting. And I think the information mentions surgery in some cases?
Yes, for severe persistent cases where other treatments haven't worked, surgery is an option. This could involve actually removing some sweat glands, particularly in the underarms, or a more complex procedure involves interrupting the nerve signals that trigger the sweating. That's usually a last resort, though.
Right, because nerve surgery sounds pretty serious.
It carries potential risks and side effects, absolutely. And of course, going back to secondary hyperhidrosis, if there is an underlying cause, treating that condition is really the primary goal. That might resolve the sweating on its own.
So it really sounds like a step-by-step process. Figure out if it's primary or secondary, try less invasive things first, and consider more involved options only if necessary.